Hello, I'd like to give you a very quick overview of the National Hip Fracture Database's annual report for 2024. Most national clinical audits pay a lot of attention to mortality figures, and the NHFD over the years has presided over a remarkable reduction in deaths following hip fracture. So much so that we should now really be focusing on the survivors of hip fracture and celebrating how many people do survive, because that's far more people than it used to be. One of the things that we've done in this year's report is to build a sequence of very short YouTube videos that you can use, you can share, you can use in governance meetings to talk through specific topics within the hip fracture pathways. And one of this is a YouTube video talking about how you can use the NHFD database to understand your own hospital mortality and survival figures. But the main focus of the report has tried to be on the patient's experience and goals set by patients we've worked with for their care following a hip fracture. And their first goal is that after presenting with a hip fracture, they want to be made comfortable. They want to have good analgesia, good pain relief with a nerve block, and then to be admitted from a casualty trolley into a proper hospital bed where they're surrounded by the nurses, therapists, and the various doctors who will be involved in their perioperative and post-operative care. Their next objective is to have surgery, but not just to have surgery. It's not just about prompt surgery. It's about having surgery that's done well enough with good perioperative care that means that they're mentally and physically able to start getting up, getting on with rehabilitation as soon as possible afterwards. And the third goal that they set us is that they want to get back home again. They want to get back on with their life. But they also want to do that knowing that they're on treatment that will help to prevent them having a further fracture. And we've designed the NHFD report about these three goals. So the first goal of getting people made comfortable is obviously an area that starts in the emergency department. And one of our YouTube videos talks about some work we've done with the Royal College of Emergency Medicine to look at the care that's provided within the emergency department. But it also questions this challenge that we have that the vast majority of patients are in the emergency department for a number of hours, many hours in some cases. So some hospitals are getting people through the ED very quickly, but most are not doing that. And over time, the black line at the bottom of this run chart, we've seen a deterioration in the proportion of patients getting out to the appropriate ward in the period post-COVID, and we're really seeing a struggle to get that to improve. It can improve. This is the result of work in my own hospital, where we've brought in a number of resources which are there for you to share and to build upon for your own hospitals, looking at prioritising patients for fast-tracking to ring-fence beds on the ward, and that's been enormously successful in my hospital and something that is worth having a look at. Once the patients get to your ward, they're going to have a lot of questions they want to ask. There are resources that have been on the NHFD website for a number of years for patients and for their carers, which can help with that. But one of the things that we've talked about in our YouTube video there is that we find that around the country, many hospitals make no provision for patients who don't speak English as a first language. And one of the new resources that we've brought out this year is these multilingual patient advice sheets. So you can download a poster to put up in your ward, which allows you to display a range of different QR codes so that patients and their families can use a phone to download a copy in their own language of information around the operation they're about to have to try and improve some of that uncertainty that's there in people from different backgrounds. Patient's second goal is to have prompt surgery and get back well enough to get up and get going again. There's a splendid video by Josh Bannister, who's the NHFD fellow, talking about how physiotherapists can use the NHFD database and the website to examine and improve the care that they're providing. And that's certainly something you should be drawing attention to your local physiotherapists about. Great resource. But there are other resources for nurses, and there's an excellent video by Alistair McCulloch talking about using 4AT and the challenges and the importance of delirium management. From a surgical perspective, there's always been an enormous amount of data available on the website, and I'm not going to talk about the surgical ups and downs in some of these lines. But you can see the bottom line is the black line showing that only 3% of patients don't have surgery. It's possible to access data from the NHFD, and there are a whole range of big research studies going on and having been published using NHFD data, and that video will tell you about how you could apply to do that. But one of the things we've done in this year's report is to provide downloadable data for each of the hospitals in the country, so you can question whether, if only 3% of people have non-operative management across the country, why that varies so much between individual hospitals. And another topical subject, the documentation of weight-bearing status after hip fracture surgery. Again, enormous and unexplainable variation in practice that's there for you to look at the data for your hospital, but also to analyse what's going on around the country if you want. The third goal defined in the report is patients wish to get back to their original residence, back home on treatment to prevent future fractures. The REDUCE study has produced a whole range of papers examining drivers for improvements in patient care. But one of the strongest drivers that we know from that work is that understanding patient feedback, using patient feedback, following people up and taking their views into account in governance meetings has a dramatic effect, including on mortality figures. So we should be using this NHFD template to do follow-up. And that will also allow you to understand whether your patients are continuing on bone protection to prevent future fractures. This time last year, we produced this guidance on the first-line use of intravenous alendronate as a way of tackling bone protection for this group of patients. And certainly the grey line has shown thousands of additional people are now receiving bone protection after hip fracture compared to a year ago. So there's a success there in this work. We've tried with this report to make it as accessible as possible. We're trying to reach out to the tens of thousands of people for whom their daily clinical work involves the care of people with hip fracture, but for whom some of our previous reports have been too technical and too complex. So I would encourage you to share the report with them or to forward on some of the YouTube videos as freestanding elements that will drive and encourage work from different people from different disciplines. Thank you.